Dirty air and water, lead poisoning, and polluted workplaces killed an estimated 8.3 million people in 2017. That's more than smoking. It's more than alcohol and drug abuse. It beats unhealthy diets, major infectious diseases, and war. But it gets less attention than any of those in much of the world. That's according to a new report by the Global Alliance on Health and Pollution, which includes researchers, national health ministries, NGOs, and the United Nations. Rachel Kupka is executive director.
It's pointing out that a global health crisis is in fact still undercounted, still underaddressed, still under-resourced.
The report says pollution from traditional sources like smoky cook stoves and poor sanitation are declining, while modern pollution from factories, vehicles, and toxic chemicals are on the rise. Kupka notes that international investment has focused on traditional pollution.
Water and sanitation, like I mentioned, has had a lot of investment in it, so the deaths are coming down, whereas the other issues in terms of modern pollution have not received the same or equivalent amount of resources and attention.
India and China had the most pollution-related deaths, followed by Nigeria, Indonesia, and Pakistan. The United States was seventh.
There's countries from almost every region of the world present in that top 10 list. So we really are all impacted. It doesn't matter kind of where you are.
Air pollution was the leading killer, making up 40% of the global death toll. Kupka says the good news is that measures already exist that can help reduce the impacts.
There are cost-effective things that countries can do, that communities can do, that cities can do to implement and bring down their burden of disease from pollution.
Authorities can adopt and enforce emissions controls for vehicles and smokestacks, require personal protective gear for workers, and other measures already in place in many countries. Steve Barragona, VOA News.